Good morning, everyone. My name is Monica Corda. I'm the Director of Business Development at the Tech Collective. We welcome you this morning to hear about COVID-19, the review of some common HR issues that you're facing. For those of you who are unfamiliar with the Tech Collective, we're the IT industry association for the state of Rhode Island. So we provide IT training, some HR sessions, some sessions on data, cyber, open source security tools. So really we're the go-to place if you're looking for some information on IT topics or professional development. Ask you to please check out our website as well. Today we're thrilled to have Karyn Rhodes with us today from Complete HR Solutions. And as Kreos had just mentioned, we had the privilege of listening to the dry run. There's a lot of information that will be coming at you today in this ever-changing landscape of COVID-19 and how it affects our day-to-day working and living. I will ask you if you have any questions, if you would kindly put them in the chat, and I will get them to Karyn at the end of the presentation. Also, I will put in a one question questionnaire, just kind of asking if we hit the mark today, if you were pleased with what you saw. So at the end of the presentation, if you would take a moment just to answer that one question. So Karyn, I hand it over to you, and hold on to your seats.
All right, so let me just share my screen with you. Okay, very good. Great. So yes, and I welcome questions. This really, I'm here for you, so I would just want to answer your questions that you're having. That's pretty important. So we're going to talk about some common HR issues that we're still seeing. So I head up an HR consulting team. We're located across the Northeast from New Jersey up to Maine, New Hampshire, Vermont, Cape and Islands, Rhode Island, Connecticut, etc. So these are some common things that are going on that are coming into us every day. So COVID has not gone away. So if anyone thinks that it's going away, it is not going away. It's actually getting worse. We're seeing, sort of out of control COVID cases in many states across the country. Everyone seems to be nudging up a little bit, with the exception of a couple states. The issues into our team. We're getting multiple questions every day on exposures that are coming into the workplace and how you mitigate that. So we're going to review again the FFCRA. That's the Family First Coronavirus Relief Act that came out with the CARES Act. There's still a lot of confusion about this and time and how it should be handled. Face coverings, we're seeing continued issues with face coverings. We're going to talk about what's happening, who needs to wear them, handling employees or customers refusing to wear them. I did hear this morning, interestingly enough, New Hampshire, Manchester had a vote last night, 8-5, against wearing face coverings because they're thinking that the virus isn't that bad in their location. So they are voting that it's not required in any public building. Interesting. Returning to work, again, a lot of us are still working remotely. Some businesses are looking to come back to work. So how are we going to do that in a safe way? Discussion around medical screening, how to do that, and then exposures, how we handle exposures. Okay. So the Family First Coronavirus Act is known as the FFCRA, and this again provides employees up to 80 hours of paid sick leave. So questions that we're getting in, we have somebody traveling back from Florida. We want them to quarantine for 14 days. Can I use the FFCRA? Yes. You have somebody that is symptomatic, may not get tested. Can I use this 80 hours of paid sick leave? Yes. Okay, so this sick leave, you really should look at it, is COVID related. So if somebody cannot come to work and can't work remotely because of COVID, you can use up to 80 hours for that time. Now you want to code it in your payroll system, so whoever you're using for payroll, you want to check with them to find out what the code is, because you are going to get a tax credit back for this time that you pay out to the employees. So this is time on top of whatever paid time off they have. Okay, so it's in addition to that. The FFCRA also provides emergency FMLA to leave for children if their school or daycare center is closed, paid at 2/3 of their regular pay. Employers over 500 employees are exempt from this statute. So when they pass this law, they're thinking that companies with 500 or more really have an ability to be more flexible with people and maybe give more time off than other companies. There's also an exemption for small businesses, less than 50 employees, if giving this time would jeopardize the viability of the business. I personally have not seen any company that has been exempted from the DOL for this. The time is there available and the tax credits come right back to you. So the emergency paid FMLA for use due to school or daycare closures. So it's not paid for the first 10 days. So if somebody's school or daycare was closed, potentially they could use that 80 hours of FFCRA, or they could use time off that they have in their banks. So after the 10-day period, the employer pays the employee 2/3 of their regular pay for the next 10 weeks, up to $200 a day or $10,000 in aggregate per employee. Part-time employees are also entitled, and they're based on the average hours worked for 6 months prior to taking the emergency FMLA. Employers over 25 employees need to return employees to the same or equivalent position when they return to work. And employers less than 25 are generally encouraged to return people to the same job, but it's understood that they may not have the job available at the time they're ready to return to work. Now, the FFCRA is remaining in effect till December 31st, 2020. I won't be surprised if we see in addition to this added or an expansion once Congress, and you know Congress is ping-ponging this back and forth right now, but I do believe this will probably be expanded as we will see COVID into 21 for sure. So we'll have to wait and see what happens there. So the DOL came out with clarification on the emergency paid FMLA. And that is if you have a child that, you know, the school has gone to a hybrid, a couple days in class, a couple days at home, potentially the employee could use the emergency paid FMLA for the couple days remote learning at home, but not while they're in school. If the school is open generally and the students are going to school, emergency FMLA cannot be used for that time. So emergency paid sick leave, people can take, again, the 80 hours of paid sick leave if they're subject to a federal, state, local quarantine or isolation order due to COVID-19, if they're advised to self-quarantine due to COVID-19 concerns. Now, this could even be somebody returning back from, as I mentioned, a trip, flying on a plane, and telling their employer, or the employer telling them, I need to, you know, you need to self-quarantine for 14 days before coming back into the work environment. You could potentially use this time if they couldn't work during that time. So if they could work remotely, you wouldn't need to use this time. So if they're experiencing COVID symptoms and seeking a medical diagnosis, if they're caring for someone subject to quarantine, isolation, or advised by healthcare provider to self-quarantine, and notice that this does not indicate a family member, so an individual, it could really be anyone that you are stating that you need to help because they're being quarantined. Of course, we would want someone to fill out information in regard to why they're being paid this 80 hours of sick leave and maintain that documentation. So if they're caring for an employer's child, again, if that daycare or school is closed, and you know the statute had in here, if there's any other similar conditions specified by Health and Human Services, there has been no other condition specified. So number 6 is sort of mute. So employees are paid at 2/3 of pay if 4, 5, or 6 are listed above. So the interesting thing here, except for healthcare and emergency responders, there was also clarification out of the DOL in New York, who pushed back on this rule. So there was clarification that said, if you are a healthcare worker and you're a patient facing, then you are exempt from this statute. So you're patient-facing. And the rule under the CDC guidelines for patient-facing people is that they would continue to work unless they become symptomatic. If they become symptomatic, then they are not going to work. Okay? So there's a difference there. But if you're a patient-facing healthcare or emergency responder, then you're exempt from this. We want you to continue working provided you're asymptomatic. All right. So if you're in a healthcare facility and you have janitorial staff or office administrative people, they are not exempted under this law and they are entitled to the FFCRA. So the limit is $511 per day or $5,110 per employee for their own use. And again, the limit is $200 or $2,000 if they're caring for others. Right now, there's no carryover to next year. It's in addition to current PTO time. Part-time employees do apply, and again, the expiration is December 30th, but stay tuned on that. I would imagine that there's going to be either an addition to this or the effective date is going to be pushed out. So face coverings. There are different state and local requirements regarding the requirement to wear face coverings. So all of the Northeast states require employees to wear face coverings if they cannot work 6 feet away from other employees. So keep in mind that discussion that I just mentioned about Manchester, New Hampshire. Certain cities, I guess, are voting on their own whether they're going to require this or not. Most of the Northeast states are saying you definitely need to wear a face covering. And certainly they're getting more stringent and not more relaxed in most places. The state of Rhode Island, definitely Governor Raimondo is saying now that even if you have a couple of friends over, you know, you all trust each other, she wants people to wear face coverings. They're finding that this virus is spreading in those sort of comfortable environments with other people, maybe close family or friends. So just be mindful now that the protocol is that we do wear face coverings. If an employee has an underlying medical condition, the employer will determine if they can reasonably accommodate them under ADA. So this has been a very interesting issue. There's some people that don't want to wear a mask, and so they're going to their doctors and they're providing their employer with a doctor's note saying that they don't need to wear a mask. So there is a little bit of here. So although they don't have to wear a mask, maybe they have an underlying medical condition, the employer can certainly prohibit that employee from working in the work environment. They may not be able to reasonably accommodate them if they're in a customer-facing situation or they don't have a private office. An employer cannot allow somebody to come into a work environment potentially spreading a lethal disease or illness to other employees. So that is protected under OSHA's general duty clause, that they have to provide a safe environment for their employees. So if people cannot wear a mask, maybe they could wear a face shield if they have to work in the work environment. If that's not reasonably accommodated, then they may not be able to work. Okay, so this can get a little tricky here. There's some federal statutes, ADA involved, and so on. So if you have anyone in that situation, you can certainly reach out to me and we'll help you through that. So customers, you need to see if you can reasonably accommodate a customer. So a reasonable accommodation may be that the person has to use takeout service or curbside pickup. You've seen in the news, I've also seen some violent episodes with people getting mad. They're not wearing masks, and the restaurant or business come into the restaurant or business if they're not wearing a mask. So that is the proper protocol, that they need to wear a mask coming into those businesses. There isn't really a reasonable accommodation, as you can imagine. If you're walking into a restaurant and someone just comes in without a mask on, they could potentially spread it to other customers, to their employees. So that's not a reasonable accommodation. So we have to see, again, if they can do takeout or curbside pickup. If somebody is getting really upset, we don't recommend that employees by themselves deal with those employees, with the customers, excuse me. We would want managers to step in, and hopefully managers have been trained in how to de-escalate the situation or be ready to call the police if necessary. So some communities are mandating face shields to be worn in person. Again, I know Brookline has stated that if they cannot wear a mask due to underlying health conditions, they need to wear a face shield. So I would expect us to continue to see this struggle with the face coverings. We want staff to be trained in how to deal with customers who refuse to wear a mask. We want, again, to try to de-escalate as best they can, and then manage, again, we want to train them on how to de-escalate, what to do next, if police need to be called, when do you call them, and so on. So interesting developments with face coverings. We've seen a lot of situations coming to us where employers are complaining that their employees are wearing political statements on their mask. So whether it be Black Lives Matter, whether it be Trump masks or any other political mask, how do they handle those situations? Generally speaking, you want to have a policy on mask wearing. The mask has to be solid in color, or you could provide your employees a mask with your logo on it. What you should not do is create a policy, a written policy that states we don't allow Black Lives Matter masks, or we don't allow Trump masks, or what have you. So there's 2 class action lawsuits going on right now, one against Starbucks and another against Whole Foods, because they created that sort of a policy. Okay, so we do not want to go down that path. So returning to work. So if your employer in Mass or Rhode Island and you haven't been returned to work, but you're considering bringing people back to work, understand that Mass requires a COVID-19 control plan, a compliance attestation poster, employer and worker posters. So you need to put postage around the work environment talking about proper protocol and washing your hands and wearing your mask if you get up from a desk, so on and so forth. Okay. Medical screening in Massachusetts is optional. Unfortunately, it's not required in Massachusetts, but it is certainly recommended by the CDC. So Rhode Island also requires employers to develop a COVID control plan. It has to remain on the premise of the business and must be made available to the Department of Health. So Rhode Island does mandate medical screening of employees, and employers need to provide employees with face coverings, so they have to do that because it's mandated in Massachusetts and Rhode Island. All right, so these control plans, or whatever you do to return your employees to work, should be communicated to your staff. You want to be very transparent in what you're doing to provide a safe work environment. You definitely want to document everything you're doing. There has been discussion at the federal level as to whether certain employers would be exempt from lawsuits. And the conversation that I'm seeing is that they don't want to provide any exemptions because employers should be doing the right thing. My best recommendation is that you call very carefully, you document what you're doing. At the end of the day, you want to be able to show that you did everything that you could to keep people safe and exposure still happened. That is going to be your defense if something moves forward. It's the employers that are not doing the right things, not putting up posters, not doing medical screening, not putting up the control plans or sharing their training with employees on what their control plan is. Those employers are in jeopardy of lawsuits, potential class action lawsuits. So I definitely recommend for everybody to make sure that they have these control plans in place and they're following the protocol from their state. If anybody is unclear about the protocol, please let me know, and I will certainly send you what it is you need to do. So social distancing, as you know, this is nothing new, has to be maintained. We have to provide signage for that. You may need to rearrange your desks or put up plexiglass. Hallways may need to be marked as one way. Shifts may need to be staggered. People have brought up the safety of the air quality. Are you able to open windows in your facility or not? Do you need to have filtration systems that you're bringing in that change over the air? Like, we all need to be thinking about this if we're going to bring people back to a work environment. If you have high-touch items, coffee pots, toaster ovens, consider closing them and putting them away. The break rooms, actually interesting. Rhode Island Governor Raimondo has asked all businesses in Rhode Island to close down break rooms. These are not large cafeterias. These are the small, maybe coffee rooms where employees congregate. They are seeing a spread of COVID through break rooms, so she'd like us to close those down for 90 days. If you have a large cafeteria, that's fine. Employees can still go in there, but you should encourage them to maybe eat at their desk or go outside. We just want to stop people from congregating together and spreading this virus. You may want to create pods or teams of employees. So if one pod or team goes down, you have another team ready to step in and do the work. So what other things should you focus in on? You want to encourage technology. You know, this is Tech Collective. We want to encourage the use of technology and not in-person meetings. And I understand, like, somebody's in an office right next to you and you want to go over and see them. We need to just think about safety, 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 and call them on the phone, you know, signal out to them or so on, but do not go over to their office and enter, or their cube and enter. So travel, and I know we're getting incredibly tired of all of this, not going anywhere, not doing anything, and we just want to get on the road and travel and see our friends. You know, we really need to continue to avoid unnecessary travel right now that is exposing people in different areas. Different states have different travel restrictions, so we need to follow those. You know, and there's been a lot of chat about enforcement of travel with these state restrictions. We haven't seen, and we're not really seeing, a lot of enforcement if people are flying into the airports. It's sort of on an honor system. And I have heard that if people are pulled over by the police, they may be asked if they're quarantining. So, and there are fines associated with it. Coming to Halloween, you know, it's going to be based on each community. Rhode Island is saying Halloween can still go on, but you need to be socially distanced, maybe put the candy outside in a little bag. You know, people should wear masks and so on. So at the workplace, we talked about ventilation. You also want to consider the PPE that's necessary to keep people safe, whether it's, you know, a face mask, whether they need gloves, whether they need a gown. What is necessary to keep people safe? I know at the dental offices, they're wearing goggles and they're also wearing a face shield with a mask over the goggles. So consider that what it is you're going to need, and make sure that you get that for your staff. Encourage hand washing, sanitation stations throughout the workspace. You know, people have been incredibly creative. I'm sure you've seen this now, going into maybe a store and they have outside of the store a sanitation dispensary and they want you to sanitize before going in. That's pretty smart idea, right? To stop that from coming into the store. So think about things like that. So the medical screening, again, is not done by a medical professional. This is somebody at your work site who's going to be responsible for the medical screening. Now, there's many, many different ways to do this. You know, I'm having the staff in Rhode Island complete a medical screening form prior to coming to the workplace in the morning, taking their temperature. If everything is good, then they're welcome to come to the workplace. When they get there, they're doing another screening tool. If everything is still no, then they're welcome to work in the work environment. If there's a yes indicated on any of the form, they should not be coming into the work environment, and they should be contacting their manager. So the state of Rhode Island has, you know, the Crush COVID app, and there is now a green smiley face if you complete that app, and you are safe to go. You can sort of show that app as you travel around the state if you need to go into different stores or what have you. Medical screening is a very good idea. That is another defensible way for you to protect your organization. If you come up with some sort of medical screening, whether you're taking temperatures, asking the questions, that information you collect has to be stored confidentially. There are some ADA concerns involved here. HIPAA not so much, but I know that the medical screening that we train people in, I'm also having them go through HIPAA training just so they understand the confidential nature of the medical information that you're collecting. Massachusetts wants all employers to anyone coming on site. So, and you probably have seen this too. Sometimes you go in and they'll say, what's your name and phone number? So they're keeping that log in case there are exposures. The Department of Health will want to see that. All right, so probably a good idea. The other thing that you might want to consider is cleaning log. So before people leave the office for the day, they are sanitizing any place they touched, so that everyone can be assured that the office is as clean as it can be. Okay, so again, this is just going over medical screening. The training we do certifies them on HIPAA and ADA. You definitely need to send out a notice to staff, clients, vendors, salespeople, informing them they're required to go through screening before coming into any company building or workspace. I don't know a lot of people who are allowing external salespeople, vendors, etc., to come into their work environment. But you want to consider what your policy is going to be regarding that. So this is just the protocol. So medical screener, if you have a physical person doing this, would ask each person to complete and certify the questionnaire. You would take their temperature. If it's 100.4 or higher, they have to stay home. They need to certify their temperature on the medical screening questions and answer all of the questions. And these are the questions, you've seen these everywhere. You know, there's only one that's changed a little bit, and that's in regard to travel. But, you know, these are pretty standard across the Northeast. Let's see, again, if they're answering yes, you're going to exclude them from answering. Employees should be considered on the clock while waiting for, so if there's waiting time, and that's why you really want to do this dual process, because you want to stop people from coming to the workplace, then be turned away from work, so that you don't have to pay this on the clock or waiting time. It really cuts down on that quite a bit. So they're certifying the medical screening. You know, hopefully we're not having anyone silly enough to come into a job if they're symptomatic and are going to be spreading this to other people. But we just want them to certify the seriousness of this. So this is part of the questionnaire. So when we have COVID exposures, and if you haven't had them, you likely will have them if you're in a work environment. So if you have someone that reports they have tested positive, and you should have the person at your organization that the employee should contact if there's a positive case. That person should be immediately isolated from others and sent home with instructions to contact their doctor and the Department of Health. The area should be clean and sanitized per CDC recommendations. Some employers per policy are deciding to shut down that area either for 24 or 48 hours before cleaning. That's totally fine. Just consider what your policy is going to be and follow that. So the employer would also contact the local health department and let them know. Contact tracing is required for employees who have a diagnosed case and come in contact with someone diagnosed with COVID-19. A memo then needs to go to all employees or customers that were in close contact, notifying them that there was potential exposure. So some employers are really pushing back on this, not really wanting to notify other employees. We need to notify other employees. We all have a right to know and to make sure that we're protecting our health and the health of our loved ones as well. So sometimes we don't know who these other employees were that were in close contact. And what's close contact? Close contact is within 6 feet for less than 15 minutes, okay? So sometimes we may need to go to the person diagnosed with COVID and ask them, who were you in close contact with? And then notify those folks. So when can people return to work? So there's a couple different strategies the CDC is setting out. There's a symptom-based strategy. At least 3 days or 72 hours have passed since the person's recovered, which is defined as resolution of fever without the use of fever-reducing medication. Their respiratory symptoms have improved, and that's the cough, shortness of breath, and at least 10 days have passed since their symptoms first appeared. There's also a test-based strategy, and that's resolution of fever without the use of fever-reducing medication, improvement of respiratory symptoms, the cough, shortness of breath, and 2 negative test results collected at least 24 hours apart. Now, we're having a lot of issues with tests. So somebody was with someone who was COVID positive on Wednesday, so the employer asked that employee to get tested on Thursday. Typically, there's not enough virus in their system to test positive, so they're getting a lot of false negatives. The other issue is with the rapid tests, people are not using it correctly, and so they're getting a false negative. The other issue with the tests is that we know the virus stays in the system up to at least 3 months. I know there's a lot of research being done on that right now. So this negative test results within 24 hours, is that going to take weeks and weeks? I don't know. So we're looking at really, the CDC is really favoring a more time-based strategy now than the test-based strategy. And that's not to say that if you're asymptomatic, you shouldn't get tested. The governor and the CDC are really, really want all of us to get tested. And if we have any symptoms, to get tested. So somebody's asymptomatic, they test positive, when can they come back to work? Again, that time-based strategy, 10 days have passed since the first COVID test, assuming they've had no symptoms since that test. If they get the test, again, that negative, the CDC is recommending that those 2 negative tests 24 hours apart. And just a positive test doesn't necessarily correlate with someone's ability to transmit the disease. So we're all a little bit different in regard to that area. So that's what I have to share with you today. I'm happy to take some questions. Let me just see if I can stop sharing the content there. There we go.
I like that Monica is on mute, and I'm like, I know she's
Sorry.
talking.
I know she has a question. I know there's something. So recently I traveled to New York and then went for an appointment, and I was up front with the person who I was seeing for the appointment, and I said, should I still come in? I've traveled to New York within that 2 weeks. And they were like, oh, New York is a good state. Okay. Where is there a place, or is there a place where we are able to see, like, because the states move on those lists, is there a central area where you can look and say, like, hey, I was in Connecticut, Connecticut's now a bad state, or I was in New York?
Yeah, it's a good question. You really have to look at the state, the individual state. So if you take a look at the Mass Department of Health website, it will list travel restrictions. So you want to go under travel restrictions. And they're listing out all of the safe states. And you're correct, it's going to change all of the time. So Rhode Island also is taking a look at that and saying if you come from a state that's like above 0.5 positivity rate or 5%, what have you, you know, you need to follow the 14-day quarantine. Generally speaking, all the states are saying if you're coming into our state, you need to quarantine for 14 days. That's generally what they're saying. Again, there's safe states, but they're you know, toggling on and off as weeks go by, and I think we're going to continue to see that.
Okay, thank you. We do have a question. It says, we have an employee who has a family member with an underlying health condition and they don't want to return to work. What do we do? Yeah,
so this is a tricky situation, and this is happening too. So unfortunately, if they're have a family member and they're afraid to come back to work, you know, if they can't work remotely, unfortunately, you're in a situation where the person can't do their job. So the employer is going to have no choice but to separate from that employee, and that employee can collect unemployment. I'm, you know, advising companies to tell that person that when a time comes that they are able to come back to work, they should reach out to them and see if they can be reemployed. You know, just try to be kind and to each other and consider it, because people do have these real life scenarios out there.
Let's see. Question was asked, what if someone was out earlier in the year due to COVID, took time off and it came out of their PTO, is there a way to kind of to get that back retroactively?
Using the FFCRA?
Yeah.
So I would think that if an employee, so the federal government is really leaving this up to the employer to decide how they're going to handle this time. So say somebody took time off, I don't know, end of February, March, and they were actually sick with COVID and it just wasn't identified yet. And now they're saying, you know, could I restore that time with FFCRA money? As long as the employer is authorizing that, I think that they could go ahead and use that time and just restore the PTO bank. I think we have to step away from, you know, that was at the end of February, March, and this is now that they're requesting it, and really look at the why this statute passed. And it really passed to protect employees, to give them time while they're out of work and sick and not expose other people. So I think that as long as the employer is authorizing it, I think that it's okay.
All right, thank you. I'll encourage folks to type in if there are some questions. I'm not even in HR and I'm filled with questions. Like thinking of all the small businesses I frequent, or you know, we had some people who weren't able to attend had put in some questions. Oh, I see we have a couple of people typing, so I will wait patiently for them to get these in.
So a common question also, Monica, that we get in is, you know, we have employees and they're afraid to work. They just don't want to come back to work. They're afraid. What do we do? So again, it's going to be the same strategy for people who are afraid to work and you can't accommodate it because maybe you're a grocery store and people have to be at the job. Again, that you're going to have no ability to accommodate that. So you will have to separate from that person. Again, telling them that down the road, if they want to reapply, they're certainly welcome to do that.
Okay. Well, Jean-Paul thanked you for, as always, a super informative session. And then Kristen is typing. So Kristen, if you just want to unmute yourself and ask if that would be easier.
Hi, thanks.
Hi.
Easier. A lot easier. So I'm an HR manager and we have had employees complete a health disclosure questionnaire daily when this first started back in March. You know, have you traveled anywhere? Have you come in contact with anybody who has COVID? You know, the questions, you know, traveled anywhere outside the state or the country. And now we've changed it slightly where they're just required to read this information when they come in. And if they do answer yes to any of those questions, they come and see me. They also have their temperature taken daily. So should we be having them complete this questionnaire each day, or is just having them read it, acknowledge it, and then have their temperature taken enough?
So what state are you in?
Rhode Island.
So Rhode Island specifically states that they need to complete the questionnaire each day. I mean, to me, I think what you're doing is probably okay, but the state is requiring us to fill out these screening tools every day. So I just look at potential liability, and I'd rather be safe than sorry and have somebody take 30 seconds to just check off the boxes and store it than just say, if you're a yes, then you can't come in.
Okay. All right. And with that, they should also be, the temperature should be noted on there as well? I
would, yeah. Rhode Island is requiring it, so I would. Now, whether you decide to get, you know, a thermometer, a digital thermometer that you can scan from far away, or I know my office, we bought these little disposable temperatures, so no one is actually taking somebody else's temperature, but each employee is doing it by themselves. You could take either approach, and I know now there are apps out there that companies are using, so feel free to use an app as well. But I would definitely follow to the T the state protocol just in case an exposure happens. You can make sure that you have those forms. They'll want to use them for contact tracing and they'll want to look at them.
Yeah, we have the infrared thermometer we just installed.
Perfect.
So it would record if somebody is over that temperature.
That's great.
Okay. All right. Thank you.
You're welcome.
As a small business in Rhode Island, those who see clients coming in, like you think of our hair salons and physical therapists, are they required to do temperature testing?
They should be following the exact same protocol. Now, personally, I was at the dentist yesterday and they were down to the T exactly what they should be doing, cleaning in between patients, the face shields, taking the temperature, asking the questionnaires, calling the day before. Karyn, have you had any of these symptoms? That's exactly the right protocol they should be taking. I know there's some other maybe non-medical organizations, hair salons and so on, that are sort of acting like they are following the protocol, but they're not. They're not taking the temperatures. They're not cleaning in between people. That's going to be really problematic, again, if there is an exposure and, people see in the news, well, X salon wasn't doing this, because I would bet that people would be calling into the state if they see that their salon, that there was exposures and they had actually been there. They're not going to be too happy.
Definitely. Thank you. I don't see anyone else typing at the moment. I did post the survey question. If I can ask you all just to take a moment to fill out that one question. Not a lot of writing, not open-ended, just nice and easy. Takes a second. If you would do that, that would be wonderful.
Monica, I'll just add one last thing, and that is that we're watching carefully what's going to happen at the federal level with more stimulus coming out. As we know, foreclosures, the moratorium was up in Massachusetts. This is a very concerning situation. People are going to be foreclosed on, losing their homes, in addition to not having enough food for their families. It's a very concerning situation that we're in right now. So we're just, again, watching what happens at the federal level when that next release comes out.
Okay. Well, thank you kindly. Hopefully it will be soon for those families who are feeling that pinch and are in need. But we appreciate you, Karyn, as always, giving us some fun facts to think about, ponder, watch who we're going to at outside sources and places where we're leaving our homes for and going to work. Jonna, thank you again from Vertical 6 for organizing and getting Karyn to come and help out our membership, and to Creosa from the Tech Collective team, who always does an awesome day of just orchestrating all of these moving parts for us. We're very appreciative. So thank you all. Have a wonderful day. And we will, if you need any of this information again, or you want to share it with someone else from your team, you can go on to YouTube in about a week to the Tech Collective channel, and all of our videos are there, as well as all of the other presentations that Karyn has done for us in the past. So thank you all. Have a wonderful day.
Thank you so much. Take care, everyone.
Bye-bye.
Bye now.